Leadership is so important. I'm not going to regurgitate any of the information that has been shared here this morning, but I really want to say that leadership is very important. Leadership at the very head of the Ministry of Health, starting with the Honorable Prime Minister, with the Directorate of Women's Health, and of course with the... Oh, sorry, I am so sorry. Slip of the tongue, the Honorable Minister of Health. Did not even see that. Scandal, scandal. And the leadership of the RHAs as well. Nothing that we do at a technical cooperation organization like PAHO WHO can find root and find seed on the ground and germinate and blossom unless there is leadership on the ground. And I see our midwives here from the ERHA, from Southwest. I see our focal points, or SIP focal points from Tobago, Dr. Wheeler, the RHAs, Dr. Kamini Lutchman, Dr. Randall Gooding, Dr. Sally Ishmael, Dr. Timothy. I'm sorry if I forgot anyone, but I really just wanted to underscore the importance of leadership in moving all this technical cooperation around, moving it forward. Mrs. Thomas mentioned breastfeeding, and I just wanted to touch on this just a little bit. She mentioned the theme for breastfeeding, and PAHO has also taken off of that theme as well. Our theme as well was protecting breastfeeding in the workplace, and I'd like to acknowledge, I understand that the Unit Trust Corporation and Central Bank, they also have breastfeeding or lactation units, and I think that is important, and I'd want to encourage the ministry to continue to encourage the private sector to come on board. Breastfeeding is so important. We know that women who breastfeed have lower risks for breast cancer and ovarian cancer, improved birth spacing, and may also have lower risk for diabetes and obesity, being overweight. And we know we're struggling with NCDs in this country, so that's another important reason for encouraging breastfeeding. Some of the other work that we are assisting, and I say assisting and supporting because the ministry has fully taken off in terms of its leadership on maternal and child health. We are supporting the UNFPA with the introduction of modern contraceptives in Trinidad and Tobago, because having proper birth spacing of children is very important for the health of the child, for the health of the mother. We are working with the Ministry of Health and under the leadership of UNFPA as well in terms of sexual and reproductive health policy. Dr. Surju Singh mentioned the elimination of mother-to-child. We're having a mission in September on that because we have heeded the minister's words. He wants to achieve validation of EMTCT in 2020, so we are acting on that. Minister, we listen. We are also working with the Ministry of Health to develop its maternal and child health plan of action and also an HIV plan of action for the Ministry of Health, as well as the National AIDS Coordinating Committee emanating from the Office of the Prime Minister. I'd also like to advocate for the role of the media. You two have a very, very important role in bringing the messages that you would have heard here this morning to the general public, which are very, very important messages. I'd like to congratulate the ministry for what it's doing in terms of moving the baby-friendly hospital initiative forward. It's very important. As you heard, 91% of women deliver in the public sector, and that is very important for us to get that right. I think the government of Trinidad and Tobago, under the esteemed leadership of the Honorable Minister of Health, the Directorate of Women's Health, and the RHAs, they're doing everything that is right in terms of moving this forward, and I thank you, and once again say that as for PAHO WHO, it is really our honor to work across the aisle with such skilled professionals who are very dedicated to the health and improving their lives and the health of women in Trinidad and Tobago. Thank you very much.